Good afternoon, everyone. Today I'm going to be talking about the association between ocular fundus changes and maternal fetal outcomes in hypertensive disorders of pregnancy in a tribal population. These are the abbreviations that I've used in my study, in my presentation. So why are we interested in this disease? Because hypertensive disorders in pregnancy are the most common medical complications of pregnancy, affecting about 7 to 15% of all pregnancies worldwide and about 10% of them in India. And the preeclampsia-eclampsia continuum remains one of the top 5 causes of maternal and perinatal mortality worldwide and increases the risk of severe complications such as DIC, placental abruption, renal failure, pulmonary edema, and aspiration pneumonia by about 3 to 25 times in these cases. And this syndrome also affects the eye and the visual pathways. So the proposed mechanisms of hypertension in pregnancy include incomplete trophoblastic invasion of the spiral arterioles, immunological and inflammatory factors, as well as predisposing genes and epigenetic factors. The resultant effect is vascular endothelial damage leading to vasospasm, transudation of plasma, and ischemic and thrombotic sequelae. On ophthalmoscopic examination, the findings that we can expect to find are the various features of hypertensive retinopathy, choroidopathy, exudative retinal detachment due to HELP syndrome, and CSCR. Cortical blindness is extremely rare. The hypertensive disorders of pregnancy are classified according to the Australasian Society for the Study of Hypertension in Pregnancy into gestational hypertension, non-severe preeclampsia, severe preeclampsia, and eclampsia. And hypertensive retinopathy is graded according to the Keith-Wagner-Barker classification into grade 1, 2, 3, and 4 grades of hypertensive retinopathy. The objectives of my study are to determine the association between ocular fundus changes with maternal mortality and fetal outcome, and also to determine whether the fundus findings would serve as a tool in assisting the obstetrician in assessing severity and managing the disease. This was a prospective analytical study of 150 patients with HTP done after ethics clearance, and patients who had a history of chronic hypertension, convulsions, or corneal or lens opacities were excluded from the study. Blood pressure was measured thrice, 15 minutes apart, and the average of the last two were taken. Eyes were dilated with 1% tropicamide and examined by indirect ophthalmoscopy. The findings were recorded bedside with 20D lens and camera, or if the patient was ambulatory with the fundus camera, OCT was done in appropriate cases. The statistical analysis were performed using SPSS by IBM version 19. The results were as follows. The mean age of my patients was 25.6 plus minus 4.3 years. Fundus changes were seen in 76 cases and no changes were recorded in 74 cases. Maternal and fetal outcomes did not correlate with blood pressure but correlated significantly with the severity of ocular fundus findings. Staggering 67.3% patients had less than 3 antenatal visits and 31.3% patients had no antenatal visits before they came to us. The fundus findings were present in 19.4% cases of mild preeclampsia, 46 cases of severe preeclampsia, and 92.3% cases of eclampsia. So there we can see that there is an increasing prevalence of fundus findings with the increasing severity of HDP, as is shown by the figures in this chart. And maternal deaths occurred in 10 cases, and all the patients who died had positive fundus findings. And as we can see from the figures in this chart, there is an increasing frequency of maternal deaths with increasing severity of retinopathy. And it also shows the frequency of mortality with exudative retinal detachment, which is 18.2%. So fetal outcome and maternal fundus changes. There were 15 preterm births and 6 intrauterine deaths out of 150 patients, and fundus findings were present in 86.6% cases of preterm birth and all of the cases of IUD. The correlation analyses that showed that there was an inverse relation between fetal outcome and maternal outcome with hypertensive retinopathy. So basically, fetal and maternal outcomes are worse with higher grades of retinopathy. This correlation was done by Spearman's correlation test with a p-value significant at less than 0.05. These are some pictures of our patients taken with the 220D lens. This is a grade 3 hypertensive retinopathy showing retinal haemorrhages, grade 4 hypertensive retinopathy showing disc edema, haemorrhages, and dilated tortuous vessels. OCT of left and right eyes of a patient showing neurosensory detachment, exudative retinal detachment in the left eye captured with a 20D lens, and the same patient periocular edema as well. So when do we decide to terminate the pregnancy? The Canadian HDP working group suggested that severe complications of pregnancy, which include cortical blindness and retinal detachment, warrant delivery irrespective of gestational age. And 11 out of 150 patients of ours had exudative retinal detachment. And of these, 5 had severe preeclampsia and 6 had eclampsia. So we know that if there is exudative retinal detachment, we should terminate pregnancy. But we are also hypothesizing that if there is more severe hypertensive retinopathy, then also we should the obstetrician should consider termination of pregnancy. And antenatal care, so majority of our patients had less than 3 antenatal visits, and so along with grades of hypertensive retinopathy being higher, maternal outcomes were poorer with lower number of ANC visits in our study. The Florida Pregnancy Associated Mortality Review Summary of Preeclampsia related deaths found a higher risk of death in patients with limited prenatal care, and Mohammed et al. Also found similar features. So in conclusion, all hypertensive diseases in pregnancy should undergo ophthalmoscopy, as ocular fundus changes are important prognostic indicators of maternal and fetal outcome. It has the added advantage of being a non-invasive technique and can be undertaken in resource-poor settings by trained people. And higher grades of hypertensive retinopathy and exudative retinal detachments are poor prognostic factors, which can alert the obstetrician and lead to more intensive monitoring or the termination of pregnancy. Thank you.
Just on the basis of the conclusions, what you are saying that funduscopy should be done in case of hypertensive retinopathy. So that is anyway done and recommended.
Yes, but also the another conclusion is that so the obstetrician, so there are certain high risk factors that we consider, that the obstetrician considers that the termination of pregnancy should be done earlier than term. So we are hypothesizing that even in higher grades of retinopathy like stage 3 and grade 4 hypertensive retinopathy, even then they should consider earlier termination to decrease the maternal mortality.
Yes.
You did not provide any data to support your hypothesis. Based on whatever you have done, you did not analyze the data to suggest your hypothesis.
It's a very strong statement you're saying, no?
Yes.
You're saying 3 and 4 you terminate. What you're trying to say is terminate all stages of 3 and 4.
No, I'm not saying, but I'm saying that
It's
there's an
recommended.
inverse, recommended, and there's an inverse correlation analyses showed that there was an inverse relation between the two.
These are all known things. Actually, what new you have found?
And if you're making a recommendation, then it has to be supported with a very strong evidence. If you are suggesting that the pregnancy needs to be terminated even when you're having a stage 3 and 4, does your data support that?
There were higher, so there was higher maternal mortality seen in stages 3 and 4 of hypertensive retinopathy.
How did you treat these detachments, exudative detachments?
We did not treat them because most of the time they resolve by themselves once the blood pressure decreases.
So once the blood pressure decreases, and then also you will advise the termination of pregnancy?
No, not at all, because that happens after the pregnancy is terminated in any case. That happens after delivery.